So the definition of racism from a public health standpoint is a system of structuring opportunity based on race, which is an artificial quality that advantages some groups and disadvantages other groups. So with that understanding of racism as a system of advantage or disadvantage, sexism is similar to that. And so when you think about racism and sexism together, how do they influence each other and how do they impact women of color specifically? So gendered racism looks at how might racism be different for women of color that men of color might not experience, and how might sexism be different for women of color that primarily white women would not experience. And so gendered racism gets at those two issues together. The purpose of this study is to investigate how gendered racism impacts the mental health of Black college women. So the findings were pretty stark. We saw that the depression and psychological distress rates were extremely high for Black college women on campus. Comparatively to national rates, they're almost twice and sometimes 3 times as high if you're looking at major depression. This is depression and psychological distress that can be diagnosed and require treatment to help them function. So what we saw is that there's a significant high rate of depression and psychological distress with Black college women here on campus. We also were able to see that gendered racism predicted some of the stress. So if we can understand better gendered racism, we might be able to help with the depression and psychological distress rates. We also wanted to focus on coping. And what was startling was that although Black women were using various coping strategies, none of them were effectively reducing or had a negative relationship with the issues that they were dealing with. So if I'm feeling depression, the depression rates increase as their coping strategies increase. So although they were trying to cope, none of those coping strategies were decreasing their rates of depression or psychological distress. I think it's important because we recognize that Black women's mental health is specific to Black women, and so unless you focus primarily on certain groups, you won't really uncover what's at the core of those problems. So we were able to identify ways to help Black women cope better by better understanding gendered racism as a system so that it does not become internalized. And so how do we, kind of buffer the internalizing aspect of racism so that they can cope better on their own?